Hello everyone, my name is Ali-Mohamed Nassur and I present this work on behalf of Action Contre France. I will present the preliminary results of our ongoing study on the prevalence and associated risk factor for diarrhea in children under 5 in Haiti, BurkinaFaso and Madagascar. Acute diarrhea disease are the second leading cause of death among children under 5 years of age worldwide. The characteristics of the child's immediate environment, living conditions, and behavioral factors like hand washing have been shown to play an important role in this condition. Furthermore, childhood malnutrition is known to be closely linked with diarrhea disease. To implement evidence-based programming, SF conducts standardized contextual studies called LINK-NCA to identify factors associated with acute malnutrition. Data from 3-link NCA performed with the same methodology in Haiti, Burkina Faso, and Madagascar are available and have previously been analyzed to assess the risk factor of malnutrition. We hypothesize that risk factor for diarrhea may differ from those for malnutrition, and that identifying them could further help characterize the link between diarrhea and acute malnutrition in informed sectorial programming. Therefore, our objective is to assess the prevalence of diarrhea in each of the 3 countries and identify associated country-specific or common factors in children under 5 years of age with or without malnutrition. Cross-sectional survey data were collected via questionnaire administered to randomly selected households with 2-stage cluster sampling. The reporting by the mother of diarrhea in children under 5 years of age in the past 2 weeks before the interview was used to estimate prevalence rates in each country. As well as retrospective data on mobility, food security, livelihoods, and water sanitation and hygiene were collected at household level. As data infant and usual feeding and anthropometric measurements were collected. For our primary analysis, we explored the only variable with the same modalities and the same definition in 3 countries. Determinant analysis include child's vitamin A, respective mobility, and child's hygiene. Participant characteristic and prevalence rate were estimated, and the association between diarrhea and malnutrition status was tested with the Q-score test in each of the 3 countries. Logistic regression were used to analyze the association between exposure and outcome in each of the 3 countries. In each country, the sample of children had slightly more women. The mean age of the children was 29 in Haiti and 30 in Burkina Faso and Madagascar. Prevalence of diarrhea was 33% in Haiti, 16 in Burkina Faso, and 36 in Madagascar. The prevalence rate of diarrhea and acute malnutrition were significantly higher in Madagascar than in Haiti and Burkina Faso. In every country, diarrhea was more frequent in children with GAM than in children without GAM. Among children who suffered from diarrhea, the percentage of children with GAM was less than 5%, except in Madagascar, where 14% of children with diarrhea also had GAM by weight for height. Among children who suffered from diarrhea, GAM by weight for height was more frequent than GAM by MIAC. In all countries, the majority of children with GAM by MIAC also reported diarrhea, 50% in Burkina and 75% in Haiti. Diarrhea was more frequent in children with GAM by MIAC than children with GAM by weight for height. No significant association was found between diarrhea and GAM except for GAM by MIAC in Madagascar. For the multivariate analysis, all variables included in our different model, a selection to find the best model was performed using the stepwise method. In multivariate model, the results show us that in every country favored 2 weeks period, the survey and seeking medical care was significantly associated with diarrhea. No significant association was found between diarrhea and acute malnutrition in multivariate model. However, sample size were small. This is due to the fact that, unlike in univariate analysis, missing data in each variable add up in multivariate analysis, decreasing the amount of children that can be analyzed. and also the number of malnourished children is low. It should be noted that we have chosen to analyze each country separately in the first instance, after which we will group the data for pooled analysis, which will help us obtain a higher sample. The limitation of our study are those of a cross-sectional study who don't allow to establish causality and temporality. Furthermore, diarrhea was reported by the mother, and like other retrospective data, may be subject to recall bias. Baseline assumption and potential risk factor differ in each study context. Although this is the first step of the analysis, we can conclude based on those preliminary results that diarrhea and acute nutrition appear to be deeply interrelated, and that low MUAC seems to be a good predictor of their disease. Presence of fever and having a certainly sick medical care or associated diarrhea irrelevant of context. Those results can be used for a better orientation of a safe program and our partner in each setting. Our finding will further be consolidated with additional data from linked insights from other contexts of intervention. Thank you for your attention.